There's a lot of conversations around the country about who are the best fits for providing behavioral health services in primary care settings, and that gets really more complicated when you add the EMRs, because not only do they have to be a certain fit, but they also have to be very computer proficient. So that does narrow your pool down some, as does some of the licensure changes, and but what we do know is that aside from being computer proficient, they have to be incredibly flexible. These are not, I'm going to come in, I'm going to sit, I'm going to do 45 minutes of therapy, that's out, that's done. To be able to be interrupted during sessions, to be able to really understand that you have multiple sets of clients. Your client is your client or your patient or consumer, or however the community is your client, your primary care providers are your clients, and that there isn't sort of going to be this one referral. These are folks who do behavioral interventions. These are the folks who say, okay, we have what we can work with today and can see people for a shorter period of time. These are folks who are okay with multiple presenting, issues and able to prioritize into maybe just one. These are folks who have a real understanding and appreciation for the entire, person, and have a real understanding of physical illness and chronic disease, and who are okay with doing care management and mental health services. These are people who really understand community health, who are interested in prevention, who are interested in trying to be a driving force in the center where they work around assessing prenatal patients, around identifying children who could have developmental delays or autism, who are able to really provide interventions and training for primary care providers in ways to identify people in abusive situations, who can be very proactive, who can react to crisis but also can be very proactive. One of the first things they did was talk about interviewing, and they selected positions through the organization that they felt should have interdisciplinary interviews. And they came out with a list of jobs, some of which were physician, dentist, any management position in the centers, so a practice administrator, a dental director, a regional social worker, medical director, anybody who was coming in as a nurse manager. Those positions, that the second interview was going to be an interdisciplinary interview and would have to have people from administration, from behavioral health, from medicine, and that and that recommendation went to the management group, it went to HR, and it was actually adopted in the organization. So what we're really doing now is trying to work with all of the practices and across the organization to really make sure that these interviews are happening, and people are very receptive to it.
One of my mantras in hiring is I hire for attitude and train for skill. So I need to know that there's something about that individual that's willing to work with the patient population for which that they're going to serve. I can teach you how to give a vaccination, but I can't teach you how to be respectful and courteous to my patients, regardless of how they appear. So the nursing staff that come to us, they come because they believe in our mission, which is foremost. And once they understand what the mission is, they're willing to learn, because we have such a diverse range of services. They can do women's health. They can do adolescents. They can do mental health. They can do pediatrics. They can do OBGYN. They can do geriatrics. They can do internal medicine. There's so many different areas for them to sort of stretch their wings and find their individual nook that they're very interested in.
Well, I think, once you're looking at someone, you have to help them to understand the community that you're serving. And if they're not able to understand that mental health is part of treating health in general, then it's unlikely that they're going to be able to buy into what you're trying to do at the practice level. So you want to make sure that they understand the population that you're serving. You want to be able to know that they're sensitive to mental health issues that it's their responsibility that if they see it, there's nothing wrong with identifying it to the provider to be able to begin the treatment process for that. And in terms of providers, you want to understand that they're also comfortable with treating it, comfortable with their education about these different ailments, and comfortable in prescribing medications, and comfortable in having the discussion with the psychosocial team or the psychiatrist about what is happening to understand the full health of the particular patient.